Okay, awesome. So again, this gives you kind of a timeline of Amico, and you can see the breadth of products, right? You can see the 14 divisions. We started in the med gas and pipeline business back in the 80s. And then from there, we launched our architectural head walls division, and those two divisions are market leaders. And they got that, and you guys said you may have been familiar with Amico. These two divisions, these two companies, they're in almost every health system across the country. So from there, the success of those two divisions, it's helped us launch the 12 other divisions. And you can see we launched a new division almost every year. And really the theme is the reason why these two divisions, our med gas and our prefabbed head walls divisions, became so successful was because of the quality and because of the innovation and because of the price. And we've tried to keep that theme across the other 12 divisions, and definitely with our OR and our patient lift divisions. But within these divisions, you can see that pretty comprehensively we can outfit an entire patient room with our patient care divisions, our accessories division, of course, our beds division, and Nick's patient lift division. And then in 2010, we launched our boom division. And then in 2011, we brought that into the operating room. And in 2015, actually, we launched our first surgical light. We were buying and reselling off a company for our lights, but we were selling our own booms. But in 2015, we launched our Generation 1 surgical light. And then in 2017, we launched our Generation 2 surgical light. Skip over this right here. Couple of our larger, I wouldn't say our larger installs, but these are Amico Group installs, I would call them. So I believe all 14 or close to all 14 of our divisions are represented in all these three facilities, and these are really notable facilities. So this first one, Vassar Brothers Medical Center, this went live about a year ago. We have 12 ORs here. We have the ICUs here, all the patient rooms here. So really nice group install. Halifax, Deltona, that's just north of Orlando, Florida. Another really nice group install, and then Duke Health. So Duke Health, we have all the patient rooms here. We're getting our lifts into Duke, I believe, and we have 10 ORs at the Duke Raleigh campus, and we are actually the boom and light standard at Duke Health, and we're also the boom standard at the Cleveland Clinic. So those are really two really nice health systems, really notable health systems that we can call on. And we've been in somewhere like the Cleveland Clinic since 2010, and they still buy from us. So that just gives you an idea of the quality of our product. Okay, now for the surgical light. So, hey, are either of you familiar with the ECRI Institute? Chace, are you familiar with ECRI? Okay, awesome. And Sean, if you're not familiar with the ECRI Institute, essentially you can view them as the consumer reporting of the healthcare industry. Essentially what they do is they rank and evaluate different types of medical equipment. And I can talk about how great our product is all day, but I thought I'd start with this. This is the most trusted evaluator of medical devices. And essentially this is their evaluation of the market surgical lights. And what they found was the Amico ICE 30M, our Generation 2 surgical light, was not only ranked the #1 performing clinical surgical light on the market, North American manufactured, but we were also given the designation as the vendor with the lowest cost of ownership. So Chace, this will resonate with you, because I know biomed sometimes they have tight budgets, but you can see that our total cost of ownership, and this takes account capital cost and also replacement parts, things like that, $66,000. And when you compare that to $120,000, $121,000, even $86,000. So some of these other manufacturers were their total cost of ownership was almost double ours. And then when you take that and you combine it with the fact that we were ranked as the #1 North American manufactured clinical surgical light, this report really pulls a lot of weight. So oftentimes our battle is who is Amico? Like, we've heard of you in on the med gas side, but who are you guys in the operating room? And this is a really good report to share with folks because it lays everything out there, and oftentimes people are familiar with the ECRI Institute. And you can see the other vendors on here, the Strikers, the Sterises. We got 4 out of 5 stars, some of them 3 out of 5, and then double our cost of ownership. So a really nice report to share with customers, share with prospects if they're not familiar with our product in the operating room.
Dave, that's actually a great tool because it's independent third party, and it's the industry that's doing the rating and letting you kind of just, present the information that way. But that's a very
oh yeah, you want to have that spot on that list.
Yeah.
100. Sorry, go ahead, Chace.
No, that speaks multitudes. I actually, as long as I've been in the industry, I actually did not know that y'all had an OR light division.
Mm-hmm.
Primarily because people want to go with the brand name. They want to go with the Steris Harmony. They want to go with the Stryker Birchall. That's typically when they think, well, our only options are, typically those 2 manufacturers, maybe Olympus. I like the fact that you guys are slowly building that up, and obviously you have momentum behind you because that says a lot. As a biomed, I have a question.
Sure.
Some of those manufacturers don't have the will, nor, do they have to, but when you consider proprietary support, so like what's the support level on these? Do you guys have technicians going out and doing repairs and services on these, or do y'all offer the ability for, like, let's say ISOs or in-house biomed teams to work on your devices?
Yes, yeah, we definitely we have service groups, and we work with different service groups. That's one thing we've been really diligent about doing, and trying to do is kind of nurture service teams and grow out our service base as we grow. So we work with independent biomed groups, and we also have our own in-house techs, but we also definitely offer training to in-house biomed teams. We're more than comfortable.
That was going to be my next question.
Yeah.
And I have an issue with the industry kind of like shutting the door completely on even receiving training whatsoever. I understand if you may not feel comfortable on, particular groups or what have you, working or getting service parts to fix, let's say the Amico light source or the boom arms or patient lists or what have you. As long as you guys are facilitating that training so we meet that credentialing, then you guys are hitting all the marks for me.
Yeah, 100%. We're more than comfortable with that. We often train up biomed teams at different health systems or just different biomed groups that work with the health systems that we're installed in. And we're a private company, so we can be pretty flexible, and we're pretty practical with these types of things as well, I'd say.
Kudos.
Okay, so just a couple points about our product, and this is kind of across the board for our patient lifts and our boom and lights, but I'll talk about the boom and lights here. So we're a total manufacturer. Essentially what that means is we don't outsource any major components of any of our equipment to any third-party manufacturers. So oftentimes surgical light manufacturers will outsource the production of their spring arm, and that's essentially the system that holds the lamp head, the arm that holds the lamp head, and they'll outsource that to a company called Ondal. And we used to do that until the release of our Generation 2 light, and we haven't looked back since, really. We had a lot of issues with this third party and not controlling our supply chain as much as possible. So we started manufacturing our own spring arm with our Gen 2 light in 2017. And as I mentioned, a lot of other manufacturers will still outsource production of their spring arm. And for our boom systems. We manufacture the extension arms, the consoles, all the accessories on the booms. And you know, we have the flow meter and SOT divisions as well that go onto the booms and onto the head walls, manufacture those as well. And then very uniquely, we're the only manufacturer who manufactures our medical gas outlets. So oftentimes you'll see actually our nitrogen control panel or some of our med gas outlets on even striker booms. We were doing a mock-up at OSU for the Wexner Medical Center. It's about 30 ORs. And in the striker booth, the striker guys actually came over. They're like, "Oh, who's Amico? I never seen you before." And we went over to their booth, and they actually had our Amico nitrogen control panel on their boom. So, and Chace, you're probably familiar with some of the striker guys. They can be a little cocky. It's a great company, but they tend to be cocky. So that was nice to show them and just be like, "Hey guys, we're actually on your boom." So that says a lot about our. If they're buying off us, then it does say a lot about our quality. But essentially what this allows us to do, and you saw it in the Icu report, is allows us to control the cost of our product, most importantly, because we're not buying and reselling off any other manufacturers. The supply of our product, which is super important right now. We've maintained a consistent 10 to 12 week lead time. We can usually get that down to 6 weeks throughout the pandemic and coming out of the pandemic. We're seeing companies like Sterile with lead times of up to 8 months, 12 months. So we have a 6 to 10 week lead time. And oftentimes Sterile isn't able to hit their lead time. And we've seen a lot of projects come back to us that we've thought we'd lost because they cut them a PO and they couldn't hit the lead time. And they were about to lose a ton of money not being able to handle cases at their surgery center or at their hospital. And they'd come to us and we've shipped out product in 6 weeks sometimes. So that's something we're really proud of.
I'm glad you spoke to that too, because actually several times this year, I've had an ear to the window or, on the ceiling or whatever. And I've heard that, with the logistical issue, because there are supply chain issues, obviously.
Yeah.
Some manufacturers are actually pushing installs, repairs, and services trainings to 2023. They're not even facilitating to this year at all, regardless of the needs of the customer. So that says a lot. I mean, at the end of the day, it's time, it's cost, and it's availability.
Exactly. And oftentimes it's like they'll prioritize, right? They'll prioritize their big customers, and a lot of these smaller surgery centers, they'll get shafted. So there's a lot of business that we can steal back from this lead time issue and this supply chain issue. And again, we're a private company, so we're very flexible. We'll kind of do what we have to do to ship product out if it means stealing business from one of these companies. So that's something that we're especially proud of these days, is keeping that consistent lead time. Okay.
As a salesperson, and I'm not in this division what you guys do, but I do like the behind the scenes competitive information that you get, because this is the big money stuff that all the OEMs are going after. And in order to do that, you really have to know, number one, what separates you from everybody else, and know the strengths and weaknesses of the companies that you're dealing with. And these are the kind of calls I really like, because you really get the behind the scenes information from, ground level of exactly how all this stuff works. And, I'm super happy that we've got you guys on here, because, Amico is sort of, they're out there, but they're a little bit behind the scenes to mainstream people like myself. I'm very familiar with the company, but now I'm getting a much better education of exactly what you guys can do, how you compare to other people out there, and just knowing, things that are going on in the industry. So Dave, I greatly appreciate you sharing all that information.
Yeah, this has been highly this is beneficial for me as a biomed. I now have other solutions that I could recommend to customers going for product divisions I had no idea you guys were taking care of, and obviously doing it very well. Mm-hmm. So well, this is a big deal.
Great. Awesome. Okay, just moving on, service, installation, warranty. Again, as I mentioned, we're growing. So this is something that we've been really diligent on keeping up with, and as I said, nurturing the groups that we work with, training them, retraining them, and growing out a base of service teams, regional service teams, other install teams, so we can give our customers the best price, and making sure we train those teams up to our in-house technician standard. But on the service side, we have a 24/7 availability, guaranteed 1 hour response time from initial contact. We're happy to chat anytime by video call, whatever it may be, but also a 48-hour on-site time, sometimes less, sometimes that afternoon. Installation, we have our own install teams, or oftentimes if the group, like let's say the group we're working with or the facility we're working with, they want to use or they have preferred installers, we're more than happy to train them up. So again, we're really flexible. That's something we pride ourselves on as a private company. And a standard 5-year warranty. We can be flexible with this if it means winning business, but how it's breaking down is 1 year comprehensive warranty, so parts and service, and the additional 4 years parts. So and this is pretty high as far as the industry goes. I think there's maybe one other company who has this type of warranty set up, but oftentimes it's just a 1 year comprehensive warranty. Then after that, they're going to charge you out they're going to charge you a lot for parts, and I'm sure Chace is very familiar with that. Yeah, you're not going to get parts cheap from some of these larger.
Or they won't sell them to you at all.
Yeah, exactly. Or they'll make you upgrade your product if something breaks to a completely new light or a completely new boom, because they're just not making it anymore, and they kind of strong arm you. Okay, so right here, this is the product itself. So this is our Generation 2 ICE 30M. So as I said, it was developed in 2017 following the release of our Generation 1 light in 2015. So what we tried to do is take all the clinical feedback we received from our Gen 1 light and build it into this Gen 2 light. And that's why it was released so quickly after that Gen 1 light, right? So we took the Gen 1 light to market, and we kind of, it wasn't like, it was a really great product, but we saw immediately, hey, here are things that we can do better. And our owner, and Nick can speak to this as well, he's a huge perfectionist, and so is our lead engineer. And you rarely see this across the industry, a new product like a surgical light coming out 2 years after. But we really tried to take all that clinical feedback and build it into this Gen 2 light. So it is a multicolor light. So 4 different color temperatures ranging from 3,500 to 5,000 Kelvin. You can see it has 4 laminar flow inlets on the light. So oftentimes, laminar flow is becoming more and more popular, those prefab laminar flow systems in the OR. So this will work with those laminar flow systems to allow that clean air to pass through. So it's got the laminar flow inlets. Here's a donut slide, but yeah, some music behind it. Right here, I'll keep it kind of short and sweet here, but we got a capacitive touch smart handle on the light. So this is a sterile field control. So essentially it's same technology that'd be in your iPhone, right? When you tap your iPhone, there's no buttons on the handle, but just with the tap of the back of your hand, clinicians can completely control the light from the sterile field. They can turn on and off the light, and they can also cycle through the brightness settings. So really, really neat feature that we've incorporated into that handle. 80 LEDs on the light, and essentially we could have gotten away. So all surgical lights these days, they'll be 160,000 lux. So we could have achieved that amount of lux, which is kind of the brightness output of the light in layman's terms, with less LEDs on the light. But the reason why we put 80 LEDs on the light was for shadow control, to achieve exceptional shadow control. So when this light came out, like, we had the luxury of looking across the market at what other vendors are doing in the market for shadow control, other technologies across the market. But what our engineering group found was by incorporating the most LEDs or the most sources of light into the lamp head itself, that's how you achieve the most reliable, the most cost-effective, and the most superior shadow control. So 80 LEDs in this surgical light. Right, here's one of the boom systems right here. We got accessory rails that run on the sides of the boom. So it's really flexible for mounting accessories. And as you know, we have a full in-house line of accessories, and all manufactured by us, all manufactured in a house. Also the flow meters, the SOT equipment. And again, going back to that theme that we're a total manufacturer, all these boom systems are completely customizable. So if you got a retrofit job in a small space, in a large space, we can customize these arms however long we need to, or however short we need to work within that space. So we can be really flexible, really nimble with these boom systems because we really control the complete supply chain on these. Okay, so this boom, I'll keep it short and sweet on this one, but the boom has a dual braking system. So this is for both our ICU booms and our OR booms. So essentially, our booms are an electromagnet or electromechanical brake. So essentially, the brake will always be engaged, but when you tap one of the points of control to move the boom, the brake will release, and then you can move the boom freely. So why this is important is, say a malfunction happens, a above ceiling power supply. If there's even a malfunction in the brake system itself over time, most vendors' booms these days are electromagnetic. So they'll all just lock into place and you can't move them. So with our electromechanical brake and our backup friction brake with just 20 pounds of force, as you can see in this video right here, you can push the boom and move it to where it needs to go. So this boom will never be locked into place. And the backup friction brake, it will stop any drifting that would happen too. So we have our electromechanical brake that will always be engaged, and that backup friction brake, just to ensure there's no drifting. And also if there's a power outage, if there's an emergency, if the nurse or the clinician just doesn't want to mess around with the brake handle and just needs to move the boom, they can push and move it with 20 pounds of force. You can move it to where it needs to go. It'll never impede workflow. It's just a nice in case of emergency feature, and a good service feature as well.
I did have a question. For instance, OR lights. One of the number one things that I typically come across actually isn't the lights going out, which, you know, on the older ones, they had the old bulbs, but I usually come across because it's coasting. And the solution that some of the manufacturers decided to use was, hey, let's have some Allen keys to, you know, you turn it and it tightens it or loosens it. Mm-hmm. Did y'all develop anything differently compared to that, or is it still kind of like the same kind of, you know, build out from that?
No, it's the same. Like in terms of and drifting that's the biggest issue with any manufacturer's lights. Sterile just released a light that their new A series light. So essentially what they say, what their value prop is these lights won't drift for 5 years. And we were, I forget what conference we were at, but we were able to touch and move these A series, and you can barely move them.
Right.
So
like I said, it's not so out of place that you can't, you know, go in there, tighten it, because over time stuff's going to become a little bit looser. I was just curious, like if the industry is like came up with a solution that might be a little bit, you know, more effective, but I mean, it's not like they're just willy-nilly flying all over the place.
Yeah, no, exactly. I hear you. And there's not too much you can do. So we have tension screws in each knuckle of our spring arm.
I do like that better though.
Yeah, what we tried to do is just we acknowledge, hey, like any light's going to drift over time. Let's just make it as easy as possible to make these adjustments, right? Let's make sure there's no downtime, that you don't got to break down the entire light or the entire system. So you can see just a couple turns as a flathead screwdriver, and then you can adjust the tension in these lights. And we have these tension screws at every knuckle. We got ports at every knuckle. So we just tried to make it as easy as possible.
Yeah, I'm kind of done with the whole, Allen key screw to tighten or loosen tension on something. So I do like they'll have an actual flathead because, most nurses and doctors, if let's say a biomed or somebody can't get out there, most people have access to a flathead. They don't carry Allen keys.
Yeah, or you can just use a butter knife if needed.
Yeah, exactly. It's more user friendly. That's
right. Here, another quick service feature. So we have individually replaceable LEDs. So essentially what we tried to do was wire each of these LEDs on its own kind of individual circuit, independent of any other LED on the lamp head. So these work independently of any other LEDs on the panel or any of the other LEDs on the light. So if anything's to happen, if there's a faulty LED, let's say, or if one is to burn out, that'll just affect that individual LED. You don't have to change out the entire panel. You don't have to change out the entire lamp head. And as I mentioned, there's 80 of these in the light. So if one goes down, it really doesn't affect the performance of the light. So you can keep doing cases with this light for however long you really want with one, if there's just one LED out, and then you can just go ahead when you're ready, swap out that LED. Of course, reduces downtime with these individually wired LEDs, and of course, reduces cost.
There's still lights out there that are using the singular bulb.
Oh yeah. All right. I'll wrap it up after this because I know I'm taking quite a bit of time. But on both of our ICU booms and our OR booms, we have a hinge back door system. So essentially, there's 4 caps which will uncover 4 screws, and you can open the back of our boom just like you would your cabinet door. So if you have to do any maintenance or just yearly checks on the boom system, you can do it very quickly and easily with this hinge back door system. You can open this thing up in about 30 seconds, and you have access to all the internal components of the boom. It makes it really easy, and you don't have to break down the boom. You don't have to shut down the OR. You can do this in between cases. So just a nice feature for future proofing if you want to add services or those PM checks or any work that needs to be done inside the boom, whether it be by biomed or other vendors, even let's say integration vendors. Just makes it very easy. All right, Nick, do you want to?
I'm available.
Yes, and sorry, Nick, I took up a lot of time. Just finally, we have a we have a 4K camera. We're one of the only manufacturers to have released this technology. So something we came out with pretty quickly, and we're installing in 6 rooms in the Heart and Vascular Institute at Our Lady of the Lake in Louisiana. Right now, we just installed this in 20 rooms at Purdue University. So really new, exciting technology that we're bringing to the market.
Thank you, Dave. Before I jump in, Sean, Chace, do you have any other questions? I know the OR is extremely interesting, and sometimes these calls go on forever, but is there any other questions that you had related to the OR?
Oh, no, I pretty much got the gist of it.
Yeah,
y'all got a lot of, to me, it seems y'all have taken a lot of feedback and put that into your design, which one of my biggest gripes with OEMs is when they, try to push their new product, it's basically the same product, but with the fancier, shinier wrapper on top of it.
That's right.
So that says a lot, that you guys are actually taking customer feedback and also performance feedback and implementing that into your designs.
You took the words right out of my mouth, Chace. That's all I had to kind of wrap today's presentation up with. But essentially what I have behind me is, we'll jump straight into the safe patient handling solution. But what you have behind me is a typical patient room, which you have over 14 divisions in this one room alone. And you may say, well, Nick, where's the patient list? And what we found is that some of the rooms need to be aesthetically pleasing, and hospitals always want the nicest and the prettiest equipment now to stay and remain competitive, right? So what we actually have here is our ceiling mounted patient lift that's tucked away behind the cabinetry. And I'm not too sure, Chace or Sean, if you've seen this before, but our patient lift
I've never
is kept
seen
in
anything.
here whenever.
That's pretty cool.
That's really cool.
Right? So a lot of the time we know that patients are in the facilities a bit longer than they want. So we wanted to create a less clinical feel. And with the casework and head wall combination, why not hide the patient lift when it's not being used? Right? So if you take a look here, when we introduced our patient lift within the last few years in 2016, we introduced it based off of that feedback that you mentioned, Chace, right? How can we improve safe patient handling, making it more functional and improve clinical outcome, right? And one of the things that you actually see here is the ability to help with fall prevention by giving that patient and clinician the full room coverage of the room. Have you guys ever seen a patient room this big?
I mean, they all vary in size, but
Yeah.
I mean, usually they're filled with, you know, side tables, desks, chairs. I mean, it can get pretty crowded in a room really quickly.
Mm-hmm.
Exactly. And what you're actually looking at is a standard XY gantry, or as we call it, a H-track, right? Which gives you that full room coverage. But if you take a look to the left of the screen, you can actually see our small patient lift being transferred from patient room through a gantry gate and straight through to the washroom.
Wow.
Right? And a lot of manufacturers realize that, hey, this is a great idea, but because our lift is the smallest on the market, we've actually improved that clinical workflow, because if you take a look, it's very small, which means that it gives that patient now that further range of motion. Now, I wanted to kind of get up close and personal. You can see almost every major patient lift vendor with the market intel. Now, Chace and Sean, have you ever seen these vendors in hospitals or commonly found on shelves?
Yes, and one of them is a pain in my butt right now, but I'm not gonna put them on blast right now.
That's fine. So the reason why we were kind of motivated to kind of help the whole landscape of safe patient handling is some of the feedback that we got was the patient lifts were big, they were bulky, they're hard to clean, and of course, you know, Chace, they're hard and sometimes very difficult to service. So when you take a look at actually removing one of these patient lifts, you got to take out your toolbox, get the right tool, bring this 40 to 50 pound patient lift all the way to the end of the track, remove the end stop, and then rip the patient lift apart just to change, for instance, a simple battery, right? Now you take a look at the size of these things. You take a look at some of the cords and, you know, not very infection friendly, right? But then you look at our design, and by far we're the most innovative ceiling mounted patient lift vendor on the market. But the one thing that set us apart, and you know, many hospitals, especially in New York right now, we just won an award at Lewis County General Hospital. And the one thing that allowed us to win this project is the unique ability to remove the lift from the track without the use of any tools. And what that looks like is this. Have you guys ever seen a go lift being removed from the track?
Mm-hmm.
It's extensive, or it can be. I'm
Chace,
actually I'm very perplexed to see this, because that's
you've had some fun
that's a
working
game
on
changer.
those. Yeah, you've had some fun working on those, Chace.
Absolutely. Well, fun's not the word I'll point to, but
And the chances are the reels are obviously not this low, they're right flush or recessed in the ceiling, right?
You might need a little
But
step ladder or two.
That's right. So why not simplify that process? So essentially what you have here is our very famous GoLift 700. It weighs 10 pounds and it can lift up to 700 pounds in weight capacity. But you'll notice, Chace, that on the tethered hand control, there's no Velcro. There's no
And
hook.
you don't got the hooks. It's magnetic. I don't know what the fascination with manufacturers want to put hooks on everything, because they'll slip off and then they crack and then they break.
And the surprising thing that we continue to hear from the front line is, let's make a better tethered hand control. But if you take a look now, Arjo, Tolos, Handicare, they still make the hook. So the mere fact that we're listening to our customers, I think that's one of the biggest reasons that we're slowly taking away some market share, right? So it has a magnetic back. So anywhere on this carry bar,
Wow,
it can actually attach. Now, one cool thing that we showed on Earth was if your wall has magnets in it, it can go right on the edge, right? But I wanted to show you how cool this was to remove the patient lift. So obviously we're gonna apply a little bit of pressure on the carry bar. We're gonna put this, which is also magnetic. We're gonna apply a little bit of pressure on the base of the patient lift, and then the patient lift comes right off.
So the hand control, is it actually used to release a electromagnetic lock?
So the hand control as of right now is just magnetic on the back. There's just a magnetic plate here.
Yeah.
Which means that it'll connect to anything that's metal.
I was curious if you were using the control to release the locking mechanism from the top.
Great question. So with the quick connect technology, so I'm sure you've realized that patient lifts are often manufactured with a fixed trolley to the patient lift itself. And that's why you have to slide it out of the rail just to remove the patient lift. Now, with our quick connect technology, we have these spring-loaded trolley adapters. So the minute that I apply a little bit of pressure on the base, it relieves some of the pressure here, and it comes right down. But I'm going to show you a funny scenario here. You're at a facility. They've asked you to change a battery. Sometimes you may need 2 clinicians. Sometimes you need a toolbox. And sometimes you need to rip it apart and bring it down to the shop. All you got to do is bring up 2 nickel metal hydride batteries, unplug them, and plug them right back in. And you're probably smiling now saying, man, I've wasted so much time doing a simple battery exchange. So it's very simple. All you have to do is plug it in, put it back in. And I'm not a biomed, so I'm sure you can do this a lot faster than I can, but I just replaced the battery. Now I'm going to attach the patient lift back. Now you have a working patient lift in a room when the clinician needs it. And this probably has been one of our biggest value adds, is the ability to not just change the battery within, 15 seconds, but what if I need to move this patient lift from room A to room B? Can I do that? Because this is extremely lightweight. And we all know that sometimes facilities have very tight budgets and they want to future-proof rooms, meaning that if they have 100 patient rooms, maybe they don't buy 100 lifts. Maybe they buy 25 or 50 and they track every single room. Now they're bringing this small patient lift from one room to another. And then when they obviously have it in the budget and there's funding, they can buy the remaining lifts. Does that kind of make sense?
One thing that I really enjoy about this from a service perspective, to give some insight, there's one particular rehab hospital right now that we currently have. I'm not going to name the manufacturer, but there's at least somewhere between 40 and 50 patient lift ceilings, just like this one. And it's a full day endeavor replacing the batteries in them and coordinating between, working in between sometimes filled patient rooms, not, at the end of the day, hospitals are running whether we're there or not. So it can be kind of a hindering, and the biomed having to traverse that environment to do those kind of battery swaps and just general maintenance on these can be a bit tedious. So the fact that you can do all that with kind of not being a thorn in a patient's side, because no patient's going to enjoy the experience of seeing somebody in their room working on something, or the clinician's not going to appreciate having to move a patient to another area because you need to work on something. So this is, you could literally walk in, grab it, take it off the lift, go do the battery thing, come back in, pop it in, you're done.
That's
Yeah,
amazing.
and you hit on a very good point there. Sean, you had something, yeah?
Yeah. So Nick, as from a sales and marketing perspective, obviously Chace has got the hands on. There's a few things that I really like. First off, I love seeing everybody else's product in that room, because in order to be the best at what you want to do, you've got to know what everybody else is doing. And like we were saying before, you got to know the strengths and the weaknesses of what every product has so that you know how you separate yourself from the pack. And you're talking about stuff that Chace can definitely relate to, which is easy to work on, easy to do, any repairs or battery changes. But in addition to that, you're getting into the size, right, which you spoke about. Now, that is a great feature, being able to disengage that, because anybody could technically do that with some minor skills. But the other point that you brought up that I'm really looking at now and really seeing clearly is the ability to sterilize that equipment. And those foam cord type cables and some of that stuff that are sort of old school, that is, like I'm looking at what you've got and I'm seeing so many advantages that I really appreciate the fact that you've got everybody else's stuff in there and you're tearing it apart and going, how can we improve not our stuff, but let's look at what other people are doing and see. Because in my world, I call it R&D. Right? And R&D technically is research and development, but for me, R&D is rob and duplicate. So when I see stuff and I'm going to do R&D, I'm looking at what other people are doing and I want to make it better. So my R&D, which is rob and duplicate, means I want to know what everybody's doing. I want to know exactly what every weak spot is. And then when I go in to do a presentation, I know exactly what separates us apart. And I can take apart everybody else's stuff and know exactly what their weakness is to give me the greatest advantage to getting that deal. And so with all the stuff that you're showing me right now, I'm very impressed.
Thank you, Sean. And, obviously to add to that, obviously we're going to be improving the product year in and year out. Some of the comments that we may get with the Quick Connect technology is it safe? And, obviously we've had situations where we've tested this throughout, right? And thousands of tests have to be done through a quality testing or a quality control before we release it before first clinical use. But if you ever have a facility that says, you know what, we love the Amico Go Lift, but we just don't like the idea of the Quick Connect technology, Amico actually manufactures the fixed version as well. I know what Chace may say, well, Nick, I really don't want to have to roll this thing all the way out. That's a thing of the past, but you will still have facilities that love the idea of fixed trolley to the patient lift where you have to roll it out of the track. But we've actually seen a lot more orders come from the Quick Connect technology. So I just wanted to share that point. The second point I wanted to share was, if you have a facility that has a number of existing tracks, obviously to rip those tracks out, to perform new construction is a very expensive and tedious task. So we actually create these trolley adapters in-house. So whether it's for LECO, whether it's for Arjo, whether it's for BHM, whatever the existing tracks are in the facility, Chace, we can match not just the track
I was actually
profile,
about to ask you that. So I
we
have,
can match, Yeah.
I have a hospital right now. They've had a silly mounted patient lift that's been down since March. To put perspective on that, that is simply because we cannot get any service from the manufacturer to come out and service it. And of course, we can't get parts from them. So after this call, give me that information. I'm going to put it in their hands, because at this point, you know, at the end of the day, they need to be able to provide service. They need to have this availability. This is critical for what they use it for. So, and also to caveat what you're speaking on about, you know, the people that would prefer fixed to the quick connect.
Yeah.
That stems from, you know, what about if patient injury could occur? Because at the end of the day, that's getting into liability. It could be, you know, the whole mess of that. You guys would not put a product out on the market like that. Well, for one, if you hadn't done extensive testing, and two, you don't, as a manufacturer, you don't want to have liability as well, because you can get sued for this too. So again, you have this out here because it's been tested. It's a viable option, and it's not something that clinicians or, you know, people that are approving these purchases need to fear.
I agree with you 100%. I think it's more so they like what they like, and they sometimes I feel like these facilities members may be so geared towards one product that maybe they're blinded to the new technology that's available, and it's tried and true. So, you know, I like where this conversation is going, and we'll definitely keep in touch regarding the retrofitting capability. And we actually have the strongest retrofitting on the market. So if you ever have a facility and you say, well, Nick, I'm not too sure if you have the right trolley adapter with the right pictures and the right scope of work. I don't know if you can actually see what this looks like here, but this is showing you exactly what the track profile will look like, but it also will show you the charge strips that are at the end and how it's being charged, whether it's continuous charge or whether it's end stop charge. Continuous charge meaning that this patient lift will charge anywhere on the track profile. End stop meaning that only a portion. That's right.
I still see the end stops
right?
used a lot today.
Absolutely. And the older facilities, for instance, we touched on it. The facilities members love it. You know, the hospitals love it because I guess they don't realize that continuous charge is an option as well. And it's more of a dummy-free option because, you know, sometimes clinicians may end up leaving the patient lift anywhere on the track. And the worst thing that can happen is not having a working lift when they actually need one.
It doesn't get charged, and then you're ruining the battery life, and you're going to have maintenance on this thing sooner than you realize.
Exactly. And I think that's where the education side and the consistent training comes in, where we have to stay top of mind and, you know, continue to check in with them. But one of the last things I wanted to share with you is our Icu Solution. As Dave had mentioned earlier, we are the only true boom manufacturer, meaning that everything that you see on the external and internal of the boom, we manufacture, just like the outlets that, you know, was seen on the OSU mock-up for the striker booms. But this is a patented solution that you're looking at. And you may say, well, Nick, there's actually a patient lift, a part of the booms. And the reason why we created it is sometimes construction costs can get very expensive. If you look at a standard XY gantry that I showed you, you have almost 6 to 8 drops coming from the ceiling. This way, you have 2 drops, one for the north boom, one for the south boom. But where I'm getting here is, why put a patient lift on here? And the reason why we actually did it is about 10, maybe 12 years ago, we were meeting with a customer in California, and they said, listen, we don't need the XY gantry in this particular room. Is there any way that you can put a patient lift on the boom arm? The reason being is 90% of the transfers that we use the patient lift for is from bed to bedside. And I want you to take a real close look at the actual patient lift going from bed to bedside. And Chace, I want you to see something different about our lift, how much further it can go on the bedside, right? So you have the patient on the bed and the patient on the side, whether it's a wheelchair or a stretcher. And the reason why this is important is because obviously we're in an environment where you may often have a bariatric patient or an individual of size, meaning that you sometimes need that extra clearance. So what we actually did before we became a patient lift manufacturer, we partnered with every single patient lift company. And that's why you see the Arjo lift, the Lico lift, the Handicare lift, because before we became a patient lift manufacturer, guess whose lifts were on our booms?
Your competitors.
That's right. So the hospitals now came to us and said, guys, your lift is so big. They thought it was our lift because it was a part of our booms, right? And this is where the clinical feedback came in, Chace, where, you know, we approached them and we said, listen, this is the feedback that we're getting, Arjo. Can we make a change? And every single patient lift manufacturer told us patient lifts are made to be big, and this is the smallest they're ever going to get. And that's why we engineered it, brought the idea back to our campus, and voila, we came up with the most innovative lift on the market. And, you know, what you're actually seeing here, kind of what Dave had touched on at the Ohio State University Hospital there in Ohio, there are 144 patient rooms that look exactly like this. And I'm not too sure if you're familiar, but they have a new patient tower going up now. And we are the basis of design for 300 more of these rooms.
Wow.
So I thought I'd share that with you. As soon as we are awarded, you guys definitely will see the pictures and some of the celebration notes, but thought we'd kind of highlight some of the ICU solutions. And since we're in our showroom, because this is how we've been presented through the pandemic, I'll kind of leave it off here and show you the two different types of ICU boom configurations. And I know Dave touched on it very lovely a few minutes ago, but you have one side of things here where you have the patient lift on the boom arm, and we call it our patient lift pendant. It's a patented solution. This side, you have an XY gantry, and you have a boom system. I know it's a lot of information to digest, but I'm hoping that we did a good job by sharing some of the relevant information that your team can actually use now out in the field, because we've actually worked with lots of institutional dealers. And I think, Chace, one of the biggest things for us is leveraging some of these relationships. We're all about relationship building and being able to collaborate on projects, because we truly believe that we're stronger together. But one of the quickest turnaround projects that we've actually seen are the retrofit projects, because they're quick and we can ship it with our relatively faster lead time. So retrofitting mean going into a facility, assessing the track profiles, realizing that, hey, we can actually put about 10 Amico patient lifts in these rooms, because Amico, 1, has the trolley, and 2, we come in at a competitive price. So I hope this was worthwhile and educational for your team.
Absolutely, learned a lot.
Yeah, Nick, I'm blown away right now, because, you know, we get a lot of this equipment. I don't know it as well as you guys do, and certainly not as well as Chace, but you know, there is a huge thing going on in the industry right now for safer patient handling. Before the call, we were talking about risk management with patient falls and a lot of those things, and everybody's trying to gear up and figure out ways to reduce, you know, those types of situations. And I'm really impressed, not only with the technology, but I'm really impressed with the fact that you're so close to your customer base when this equipment goes out, that you're getting all that feedback and you're immediately taking notes of that to figure out how you can improve on things. And I think the greatest strength that you've got that I can see from evaluating this call is the fact that everything's in-house. So you're basically there doing the manufacturing and you're basically covering just about everything in the hospital. So this has been highly educational. And you know, with Cleveland Clinic, Duke, and these hospitals that you're working with, you're certainly hitting the pinnacle providers that are out there with this technology. So that in itself also speaks for what you guys are doing.
Wonderful. Yeah. And, you know, we take pride in constantly trying to come up with new technology. As you've seen in Dave's slide deck, we were one of the first manufacturers to come out with that Inlight 4K camera. And this is stuff that facilities and surgery centers have been dying for. Obviously, they want bigger, they want better, they want nicer looking. So we're happy to come out with that technology, and we're excited to see what the future holds.
Super exciting. Well, I'm so happy you guys took the time for putting this out there. We've got the new website, Healthcare Direct USA, and Healthcare Socials and that. And so, you know, the whole goal of what Chace and myself are trying to do is showcase the people behind the scenes, showcase the companies, get to know the people and the equipment behind the scenes, and know what, you know, what companies like you are doing in the industry out there. And you're definitely leading the industry with a lot of this technology. So I'm super grateful that Dave and you, Nick, took the time today to go through this information with us, because I found it to be extremely informative, and I'm actually really blown away at how far ahead you guys are in some of these divisions within the surgical suites, the booms, and some of the stuff you guys are doing with the lights. It's really impressive.
Thanks, Sean. And we're happy to help. So if there's ever an opportunity for us to jump on a similar call like this, or anything project specific, Chace, that you may be working on where we can help in any way, shape, or form, we're happy to jump on a virtual setting. And if there needs be, and there's a large enough project, we're happy to come on site and potentially perform a quick demonstration, for instance, of our patient lift. So just keep that in mind, because we're constantly doing these calls, and we're here to help.
That's awesome. So
we're
going to post this online. I'll put your contact information on there for anybody that's seeing this information. And with 14 divisions, Nick and Dave, we will definitely be back in touch with you for future calls to talk about some of the more fantastic things that you guys are doing there at Amico.
Yeah, next time we get on the call, they'll have 5 other divisions. Just watch.
That's right. That's right.
Keep improving the medical infrastructure, guys. I like the vision. I like where you're going with it and the mentality behind it. So at the end of the day, we just want to elevate patient care. That's what it's all about.
Absolutely. We agree with you. Thanks again for your time, Chace and Sean, and we look forward to the ongoing conversations.
All right. Hey, you guys take care. Have yourself a great afternoon, and thanks again for your time today. We'll look forward to talking to you again soon.
Take it easy.
All right. Take care.
See you guys.
Thanks, guys.
Thanks, Dave.
Bye.
Bye.